Trigeminal neuralgia is often described as one of the most severe pains a human being can experience, and understanding why begins with appreciating what pain actually does to the body and mind. Pain is not just a physical sensation. It affects thinking, emotions, confidence, and daily behavior. In trigeminal neuralgia, the intensity of pain goes far beyond common headaches or dental pain. People describe it as sudden electric shock-like jolts that feel as if they pierce deep into the face. These shocks can come without warning, last for seconds or minutes, and can repeat again and again in frightening clusters. When something hurts this much, the brain begins to live in constant anticipation. Muscles tense, sleep disturbs, appetite changes, and fear becomes part of daily life. That is why it is ranked among the most painful medical conditions recognized by doctors worldwide. The severity of this pain is not only about how sharp it feels, but also about how unpredictable it is. A person might be sitting calmly, talking to a friend, sipping water, or brushing their teeth when suddenly an intense bolt of pain shoots through one side of the face. There is no time to prepare. There is no way to slowly adjust to it. The body reacts instantly with shock, sometimes tears, sometimes temporary freezing of movement because the pain is so overwhelming. Imagine living every day not knowing when that next surge will come. This anticipation alone is exhausting and contributes greatly to why this disease is considered so severe. Another reason the pain is so devastating is that it attacks simple daily activities. Chewing food, smiling for a photo, laughing at a joke, washing the face, shaving, speaking, or even feeling a light breeze can trigger pain episodes. These are not extraordinary activities. They are ordinary parts of being alive. When ordinary actions become potential sources of extreme agony, life begins to shrink. People stop talking as much, eat more slowly or with fear, avoid outdoor air or social events, and slowly withdraw from others. It is not because they do not want to live normally. It is because every tiny action carries a risk of sudden suffering. This loss of freedom is part of what makes the pain severe in an emotional as well as physical sense. The label of severity also comes from how long the condition can last. Trigeminal neuralgia is not just a short illness that passes in a week. For many people it is chronic, meaning it lasts months or years and can come in repeated cycles. There may be periods when the pain decreases, followed by periods when it returns with greater intensity. Living with long-term pain changes how the brain processes sensations. It can heighten sensitivity, affect concentration, and increase irritability or sadness. People may struggle to focus on work or studies because sudden pain interrupts thought. Over time, this constant battle wears down emotional resilience. The condition becomes not just intense pain, but a long-endurance test of patience and strength. To understand the second keynote, we must look closely at the trigeminal nerve itself. The trigeminal nerve is one of the largest nerves in the head, and is responsible for carrying sensations from the face to the brain. It has three main branches that connect to the forehead and eye area, the cheek and upper jaw, and the lower jaw and chin. Whenever you feel temperature, pressure, touch, or pain on your face, it is this nerve that sends the message to your brain. In simple words, it works like a communication cable between your face and your nervous system. Because it covers such a wide area, any disorder involving this nerve can affect large regions of the face, which explains why the pain of trigeminal neuralgia can feel so widespread and intense. In trigeminal neuralgia, something interferes with the normal functioning of this nerve. The problem often starts when the protective covering of the nerve becomes damaged or irritated. This covering helps electrical messages travel smoothly. When it is disturbed, signals misfire. A normal signal that should represent light touch may be misinterpreted by the brain as severe pain. This is why even gentle actions like touching the cheek or brushing teeth can trigger extreme discomfort. The nerve is not sending accurate messages anymore. It is behaving like a faulty wire with sparks traveling in the wrong direction. The location of the trigeminal nerve also contributes to the seriousness of this disease. It is deeply connected to essential functions like speaking, chewing, blinking, and expressing emotions through facial movement. Unlike pain in the hand or foot, which can sometimes be rested or immobilized, the face is constantly active. You cannot stop talking forever, or avoid eating, or remain completely expressionless. Since the nerve is always involved in daily activity, irritation of this nerve repeatedly reminds the person of its presence. There is no easy way to avoid using it, which means the risk of trigger pain is always present. Understanding how the trigeminal nerve works also explains why this condition is sometimes misdiagnosed. Many patients first think they have dental problems because the lower or upper jaw is commonly affected. Dentists may treat teeth, yet the pain remains because the real origin lies in the nerve rather than the tooth. Knowledge about the trigeminal nerve helps both patients and health professionals differentiate between dental pain and nerve pain. In nerve pain, the sensation is more electric, sudden, shock-like, and can travel along the pathway of the nerve instead of staying in a single tooth. The nerve has an emotional importance as well. The face is deeply tied to personal identity. It is how we express joy, sadness, curiosity, surprise, and love. When the main sensory nerve of the face becomes diseased, it disrupts not only physical comfort, but emotional communication. People begin to fear smiling or laughing not because they lack happiness, but because facial movement might trigger pain. This can create emotional distance in relationships. Loved ones may misunderstand the change in expressions or withdrawal from conversation. All of this begins with that one nerve responsible for sensation, which shows how central it is to both health and social life. Damage or irritation of the trigeminal nerve can come from several causes, such as pressure from nearby blood vessels, nerve injury, or medical conditions affecting the protective covering of nerves. Regardless of cause, the result is the same. Faulty pain signals reach the brain. Understanding the anatomy and role of this nerve helps people appreciate why treatment often focuses on calming the nerve or reducing pressure around it. Medication aims to stabilize nerve activity, while certain procedures attempt to change how pain signals travel along its branches. When people learn how critical this nerve is, they often gain more empathy for those who suffer from trigeminal neuralgia. Since the nerve is constantly active in sending messages from the face to the brain, its malfunction creates nonstop vulnerability. Anyone can understand the burden of carrying fear of pain in such a sensitive and expressive area. Education about the trigeminal nerve and its role makes the disease less mysterious and helps remove misconceptions that sufferers are exaggerating or imagining their symptoms. By linking the extraordinary severity of the pain with the pain in trigeminal neuralgia is often described in vivid and powerful language, because ordinary words sometimes feel too weak to capture the experience. Many people say it feels like sudden electric shocks rushing through the face, sharp stabs that arrive without warning, or bursts of burning sensations that seem to cut deep into nerves. Others compare it to being struck by a live wire, or to knives piercing the jaw or cheek again and again. These descriptions are not exaggerations. They are attempts to express a sensation so intense that it stops speech, freezes movement, and commands complete attention in a single moment. When pain reaches this level, it is no longer just a symptom. It becomes an event that takes over the body and the mind at once. The character of this pain is usually sudden and explosive rather than dull or aching. It can start in a split second and vanish just as quickly, only to return in unpredictable waves. This unpredictability keeps the nervous system constantly alert. The body does not know when to relax because the next surge may come at any time. Many patients say the anticipation is almost as exhausting as the pain itself. Every small sensation on the face becomes suspicious. The mind starts scanning for danger signals, wondering whether a slight twitch or tingle is the beginning of another episode. This constant vigilance drains emotional energy and can make even peaceful moments feel fragile. Another striking aspect of the pain is that it often follows the path of the trigeminal nerve. Because the nerve has three main branches, the pain may be felt near the eye and forehead, in the cheek and upper jaw, or along the lower jaw and chin. It may shoot from one area to another like a line of electricity traveling under the skin. Unlike toothache that stays centered in one tooth, this pain often travels, expands, or radiates. This moving quality makes it especially frightening because it feels alive and active rather than fixed and predictable. It reminds the person that the source lies in the nerve itself, not just in a small spot on the face. The intensity of the pain also affects the way the brain processes emotions. Human beings are not designed to experience repeated sudden shocks of extreme intensity. When these shocks come again and again, the brain connects them with fear. The heart may start racing, breathing may become shallow, and muscles of the face and neck may tense involuntarily. Over time, the nervous system becomes more sensitive. Even small triggers begin to feel bigger than before. This process, often called sensitization, explains why the condition can worsen if left unmanaged. It is not only the nerve that changes but the entire system of responses surrounding it at a psychological level. Describing the pain accurately becomes important because people with trigeminal neuralgia often struggle to feel believed or understood. There are no visible wounds, swelling, or bruises. The person may look perfectly fine on the outside even while feeling as if lightning is striking inside the face. Sharing descriptions like stabbing, burning, tearing, or electric helps others realize that this is not a mild discomfort. It is among the most severe pains recognized in medicine, and it deserves empathy and serious attention. The fourth keynote centers on how ordinary daily activities can unexpectedly trigger this extreme pain, turning normal life into a landscape full of hidden risks. Simple actions that most people perform without a second thought can become sources of anxiety. Chewing food, sipping tea, brushing teeth, or talking can suddenly set off intense facial pain. Even gentle actions like touching the cheek to wipe away a tear, or to rest the head on a pillow may provoke an attack. In some people, a cool breeze from an open window or air conditioner is enough to trigger a shock of pain. These are common, unavoidable experiences in daily life, which means the threat of pain is always nearby. When daily activities become potential triggers, behavior begins to change. A person may avoid hard or crunchy food, not because of dental weakness but because chewing might activate pain. They may speak softly or less frequently to minimize movement of the jaw. Some may avoid going outdoors on windy days or cover their face with a scarf, not for warmth but for protection from a possible trigger. These adjustments might seem small from the outside, but they gradually reshape a person's routine and confidence. Life becomes filled with calculations and caution instead of spontaneous action. The emotional impact of activity-triggered pain is profound. Eating, talking, laughing, and smiling are deeply connected with social interaction and joy. When these actions become painful, people may begin to withdraw from family meals, gatherings, and conversations. Not participating is rarely a choice driven by preference. It is a shield against possible pain. Friends or relatives might misunderstand this withdrawal as moodiness, disinterest, or isolation by choice. In reality, it is self-protection. Understanding this helps prevent judgment and replaces it with compassion. Triggers are often unpredictable, which adds another layer of distress. One day brushing the teeth might be painless, and the next day it may cause severe jolts. This inconsistency makes it difficult to build trust in the body. Routine activities lose their reliability. People may feel as if their own face has become an uncertain territory where any movement can betray them. This lack of control can produce anxiety and emotional fatigue, contributing to sleep difficulties and loss of confidence in daily functioning. From a biological perspective, these triggers occur because the trigeminal nerve is involved in almost every movement and sensory experience of the face. When the nerve becomes hypersensitive or damaged, even normal signals are misinterpreted as danger. Chewing sends sensory information through the nerve. So does talking, touching the skin, or feeling temperature changes. The nerve is simply doing its job of sending messages to the brain. But because it is irritated, the messages become distorted into pain signals. This explains why avoiding all triggers completely is nearly impossible. The face is constantly in motion, and the nerve is constantly active. Understanding the link between everyday actions and pain also highlights the importance of early recognition and supportive care. When patients and families realize that these triggers are real and consistent with trigeminal neuralgia, they are less likely to blame themselves or assume weakness. Instead, they can focus on seeking medical advice, learning coping strategies, and making thoughtful adjustments without shame. Something as simple as using lukewarm water instead of cold, cutting food into smaller pieces, or using softer toothbrushes can reduce triggers, even though they do not cure the disease. There is also a meaningful social dimension to trigger-related pain. Many cultures value smiling, speaking openly, and eating together as signs of warmth and participation. When these actions become painful, individuals may worry that others will see them as distant or unfriendly. Explaining the condition openly when possible can relieve some of this social pressure. It allows others to understand that silence or restraint is born from pain, not from lack of interest or love. When we look closely at these two keynotes together, a powerful picture forms. On one side there is pain described as electric, stabbing, burning, sudden, and overwhelming. On the other side, trigeminal neuralgia often hides behind a mask, and one of the most confusing masks it wears is that of dental pain. This confusion is the heart of the fifth keynote. Because the pain frequently strikes the jaw, teeth, or gums, many people first assume they have a tooth problem rather than a nerve disorder. The pain can feel like a deep toothache, or a sharp shooting pain that seems to come from a specific tooth, even when the tooth is perfectly healthy. As a result, the first visit is usually to the dentist, not the neurologist. Dentists, trying to help with the information they have, may perform fillings, root canal treatments, or even remove teeth, yet the pain stubbornly returns. Imagine the frustration of losing teeth one by one, while the original agony remains unchanged. This experience is sadly common for patients who later discover that the real source of pain was the trigeminal nerve all along. This misdiagnosis happens for understandable reasons. Most people and even many clinicians are taught to associate severe jaw pain with dental causes such as decay, infection, or gum disease. In trigeminal neuralgia, however, the teeth may look completely normal on examination or X-ray, yet the pain remains agonizing. The pattern of pain offers important clues. Dental pain is usually constant, throbbing, and located in one specific tooth or area. Trigeminal neuralgia pain is typically sudden, electric, shock-like, and may travel along the line of the jaw or cheek. It often comes in short bursts instead of lingering continuously. These details help distinguish the two, but they can be easily missed when someone is simply desperate for relief. The emotional impact of such misdiagnosis is significant. People begin to doubt their own perception. They may wonder if they are imagining the pain when dental treatment does not help. Some feel guilty for repeatedly seeking care. Others become fearful of yet another procedure that might change nothing. Over time, this cycle of pain and disappointment erodes confidence and hope. Family members may also become confused when repeated dental visits fail to bring answers. That is why awareness matters so deeply. When both patients and health workers recognize that facial or jaw pain can be neurological, they can avoid unnecessary extractions and years of needless suffering. Recognizing misdiagnosis also highlights the importance of communication between dental professionals and neurologists. Dentists are often the first to see these patients, so their ability to identify red flags is powerful. If the pain is electric in nature, triggered by light touch, or jumps from one tooth to another, referral to a neurologist can change the course of the disease. Simple awareness can shorten the time to correct diagnosis, reduce invasive treatments, and improve quality of life. For the patient, there is also emotional healing when the condition finally has a name. Understanding that the pain is real, identifiable, and medically recognized brings relief even before treatment begins. The sixth keynote focuses on the common causes of trigeminal neuralgia and explains why this nerve suddenly begins to misfire. One of the most frequent causes is compression of the trigeminal nerve by a nearby blood vessel. Over time, the constant pressure can damage the protective coating of the nerve called myelin. This coating normally helps signals travel smoothly and accurately. When it wears down, electrical impulses begin to leak and cross paths. As a result, ordinary sensations like touch or temperature are mistakenly interpreted as intense pain. The nerve becomes hypersensitive and reacts violently to the smallest stimulation. Another important cause is related to diseases that affect the nervous system, such as multiple sclerosis. In such conditions, the protective nerve covering throughout the body can become damaged. When this process involves the trigeminal nerve, the same misfiring and extreme pain can occur. In these cases, trigeminal neuralgia may appear as part of a broader neurological condition rather than in isolation. Understanding this connection is important because it helps doctors select the right tests and the most suitable treatment plan for each individual case. Tumors or cysts pressing on the trigeminal nerve can also lead to similar symptoms, though this is less common. The tumor may not be cancerous, yet its presence alone can place pressure on the nerve. Imaging studies like MRI are often used to rule out these structural causes. Even when nothing is found, the evaluation itself provides reassurance and guides treatment decisions. Sometimes, despite thorough investigation, no clear cause is discovered. This is called idiopathic trigeminal neuralgia. Not knowing the exact reason can be unsettling, but it does not mean the condition is untreatable. Many people in this group still respond very well to medication or procedures designed to calm the nerve. Understanding the causes changes how people think about the disease. Instead of seeing it as mysterious or imaginary, they can see the physical explanation behind their pain. A blood vessel touching a nerve, a damaged nerve covering, a compression inside the skull, or a neurological illness are all real biological events. This knowledge shifts the experience from self-blame toward informed management. It also reminds us that people living with this condition are not weak or overly sensitive. They are dealing with a nerve that is genuinely misfiring at the most sensitive place on the body. Exploring causes also opens the door to prevention of unnecessary fear. Not every facial pain signals a tumor or severe brain disease, but knowing about these possibilities teaches people to take persistent or unusual facial pain seriously enough to seek medical evaluation. Early diagnosis does not only provide faster pain relief, it can sometimes uncover underlying conditions that require treatment in their own right. In this way, trigeminal neuralgia becomes not only a challenge but a message from the body that deserves attention and respect. When we reflect on both living with trigeminal neuralgia does not only challenge the body, it reshapes the entire emotional world of the person affected. This is the essence of the seventh keynote. When pain is sudden, intense, and unpredictable, the mind begins to live in constant alert mode. People start to worry not only about the pain itself but about when it might return. This constant state of anticipation slowly transforms into anxiety. They may begin to think twice before laughing, speaking, or eating, because any of these actions could trigger another episode. Over time, this fear becomes deeply rooted, and daily life starts revolving around the possibility of pain rather than around normal activities and joy. The condition can also bring a heavy feeling of loneliness. Because trigeminal neuralgia leaves no visible marks, others may not fully understand how severe the pain is. A person may look completely fine on the outside while inside they are bracing themselves against intense electric-like shocks in the face. When people around them say things like it is only toothache or it cannot be that bad, the emotional hurt grows even stronger. Feeling misunderstood can push a person to withdraw and stay silent about their struggle. They might avoid explaining themselves, stop attending gatherings, or turn down invitations, not because they do not care, but because they are tired of trying to justify pain that cannot be seen. Depression can also become part of this journey. Chronic pain changes how the brain processes emotions. When someone repeatedly experiences excruciating pain, loses sleep, avoids social contact, and fears normal activities, sadness can gradually deepen. There may be days when getting out of bed feels like a challenge, not due to laziness but due to emotional exhaustion. Confidence can drop, self-image can weaken, and the person may feel as if life has lost spontaneity. It is important to understand that this depression is not a personal failure. It is a natural psychological reaction to long-lasting pain and restriction. Relationships can also be affected in ways that are easily misunderstood. A person who once smiled often and spoke freely may become quieter and more reserved. Family members or friends may take this personally, thinking the person is angry or distant. In reality, the movements of smiling, speaking, or even turning the head can trigger pain. So the individual conserves energy by reducing facial expression and speech. Without awareness, both sides may feel hurt. With understanding, however, loved ones can become a powerful source of strength and support. Sleep is another area commonly disturbed by the emotional weight of the disease. Fear of nighttime attacks, lingering discomfort, and anxious thoughts can make it difficult to fall asleep or stay asleep. Lack of rest increases irritability, lowers pain tolerance, and worsens emotional stability, creating a cycle where pain and poor sleep feed each other. Learning relaxation techniques, gentle breathing, or seeking professional guidance can help break this cycle. But the first step is recognizing that the problem is real and deserving of attention. One of the most positive steps a person can take is to acknowledge that mental health support is part of medical treatment, not something separate or optional. Counseling, therapy, or simply talking openly with trusted people helps release emotional pressure. Meeting others who live with the same condition, whether in support groups or online communities, can be especially powerful. Hearing someone say, "I feel that too," or "I face the same fear," can instantly dissolve the feeling of isolation. Emotional connection becomes medicine in its own right. The 8th keynote focuses on the crucial role of early diagnosis and medical evaluation, especially by neurologists, in changing the entire course of trigeminal neuralgia. Because the condition often looks like dental or sinus pain at first, it is frequently misdirected toward treatments that do not help. Early recognition saves time, money, and suffering. When facial pain is sharp, electric, sudden, triggered by touch, talking, brushing, or chewing, and limited to one side of the face, these are important clues that the trigeminal nerve might be involved. Seeking advice from a neurologist at this stage is essential, because neurologists specialize in disorders of the nervous system, including the trigeminal nerve. Once the correct specialist becomes involved, the path to understanding becomes clearer. Neurologists gather details about the pattern of pain, triggers, and duration. They often recommend imaging tests such as MRI to look at the structures surrounding the nerve. These tests can reveal whether a blood vessel is pressing on the nerve, or whether there is another cause such as multiple sclerosis or a tumor. Even when tests show no obvious structural cause, the evaluation still matters, because it confirms that other serious conditions are not present and guides the choice of treatment. Early diagnosis has another huge advantage. It allows treatment to begin before the nervous system becomes deeply sensitized. The longer the nerve keeps firing abnormal pain signals, the more likely the brain is to adapt in unhealthy ways, becoming overly responsive to pain. Starting appropriate medication or other therapies earlier can reduce the frequency and intensity of attacks, and may prevent complications that build over time. In this way, timing is not just a convenience, it is a critical part of medical success. Access to early diagnosis also protects people from unnecessary procedures. Without correct identification, individuals may undergo tooth extractions, repeated antibiotics, or other dental work that does nothing to improve their condition. This not only fails to relieve pain but also adds physical and emotional trauma. When trigeminal neuralgia is recognized early, the treatment plan shifts from random attempts to targeted strategies. Medications that calm nerve activity, lifestyle adjustments to avoid triggers, and in some cases minimally invasive procedures become clear options discussed openly between doctor and patient. Education plays a major role in enabling timely diagnosis. When the general public understands that severe electric, one-sided facial pain might be neurological, they are more likely to seek specialized care. When dentists and general physicians are aware of these patterns, they are quicker to refer patients to neurologists instead of continuing repeated dental treatments. Each step of awareness shortens the journey to relief. For the patient, simply hearing a doctor say the words trigeminal neuralgia can bring a sense of validation. The pain finally has a recognized name and explanation. Early diagnosis also opens emotional doors. When people finally understand what is happening to them, fear of the unknown begins to fade. They no longer feel lost in confusion or question their sanity. Instead, they can focus their energy on learning, adapting, and moving forward. They become active participants in their own care, rather than passive sufferers hoping the pain will somehow disappear. Treatment for trigeminal neuralgia is not a single fixed path but a journey with many possible routes, and this forms the heart of the 9th keynote. Once the condition is correctly diagnosed, the focus shifts from fear and confusion to management and relief. The first line of treatment usually involves medication designed to calm the overactive nerve. These medications work by stabilizing the electrical signals that travel along the trigeminal nerve, reducing the sudden bursts of pain. Many people experience significant improvement with medicines alone and are able to return to more normal daily activities. This success offers a powerful message of hope, especially to those who have spent long periods searching for answers. However, medication does not work the same way for everyone. Some people may experience side effects such as drowsiness, dizziness, or difficulty concentrating. Others may find that the medicine loses effectiveness over time as the body adapts to it. In such cases, doctors may adjust doses, combine medications, or try alternatives that act through different mechanisms. Continuous communication with a healthcare provider becomes important because each person's response is unique. Treatment becomes a partnership where both doctor and patient work together to find the best balance between pain control and quality of life. When medications are not enough or when side effects become difficult to tolerate, other options come into view. Various procedures aim to interrupt or reduce the pain signals traveling along the nerve. Some techniques involve using heat, radiation, or targeted compression to change the way the nerve transmits signals. Others focus on relieving physical pressure from nearby blood vessels that may be compressing the nerve. One of the most well-known surgeries, microvascular decompression, involves placing a small cushion between the nerve and the blood vessel to prevent constant irritation. Although this is a more invasive option, it has provided long-lasting relief for many people, reminding us that even severe pain can have meaningful solutions. There are also minimally invasive procedures that can be performed without major surgery. These include injections or radiofrequency treatments that partially damage the pain fibers in the nerve, so they can no longer send intense pain signals. While some numbness may occur as a side effect, the dramatic reduction in pain is often life-changing. This variety of approaches means that trigeminal neuralgia is not a hopeless condition. Instead, it is a condition with a wide therapeutic landscape in which choices can be tailored to each person's needs, age, health status, and personal preferences. The emotional impact of treatment should not be underestimated. For someone who has lived with unpredictable lightning like facial pain, even a partial reduction in symptoms can feel like regaining control of life. Simple activities such as eating comfortably, laughing freely, or stepping outside without fear become possible again. Treatment brings back not only physical comfort but dignity, independence, and confidence. Knowing that options exist helps counter the despair that often grows during long periods of untreated pain. At the same time, realistic expectations are important. No single treatment guarantees permanent cure for everyone. Some people may need repeated procedures. Others may require ongoing medication even after surgery. But progress, not perfection, becomes the guiding idea. Each step that reduces frequency, intensity, or duration of pain attacks is a victory. Living with trigeminal neuralgia becomes less about enduring overwhelming suffering and more about actively managing a chronic condition with medical support. The 10th keynote highlights the power of awareness, compassion, and social support in shaping the experience of those living with trigeminal neuralgia. Awareness starts with simple knowledge. Understanding that a disease like this exists, that its pain is real, and that it can affect anyone. When society becomes aware, stigma begins to dissolve. People stop dismissing the condition as exaggerated toothache or imaginary pain. Instead, they recognize it as a legitimate neurological disorder, deserving respect and understanding. This change in perception alone can lighten a patient's emotional burden. Support from family, friends, coworkers, and communities plays a crucial role. Words like "I believe you" and "I am here for you" can be as powerful as medicine. When loved ones understand that facial movement or speaking may trigger pain, they become more patient with pauses, quiet moments, or canceled plans. When employers recognize that the condition has unpredictable flares, they can offer flexibility that allows people to continue working without added stress or guilt. These gestures transform isolation into connection and fear into shared strength. Public awareness also encourages earlier diagnosis and better treatment access. When educational campaigns, media discussions, or community talks mention trigeminal neuralgia, people experiencing symptoms recognize themselves in the descriptions and seek medical help sooner. Health professionals who stay informed are quicker to refer patients to neurologists, rather than repeating ineffective dental or sinus treatments. Awareness shortens the path from suffering to relief, and every shortened path means fewer months or years lost to avoidable pain. Compassion extends beyond personal relationships to healthcare environments. When doctors, dentists, and nurses approach patients with empathy, listening carefully to their descriptions instead of dismissing them, trust grows. This trust makes it easier for patients to describe symptoms accurately, follow treatment plans, and return for follow-up care. A compassionate medical system does not simply treat nerves and tissues, it treats human beings with fears, families, dreams, and responsibilities. Awareness also fuels research. The more people understand and talk about trigeminal neuralgia, the more attention and funding the condition receives. Researchers work to develop new medications with fewer side effects, refine surgical techniques, and explore the deeper mechanisms behind nerve pain. Each discovery brings hope for future generations who might face the same diagnosis. In this way, awareness today becomes progress tomorrow. For individuals living with trigeminal neuralgia, joining support groups or online communities can be transformative. Sharing experiences with others who truly understand what electric shock like facial pain feels like creates a safe space for honesty. People exchange tips, encourage one another through difficult days, and celebrate improvements together. This sense of belonging reminds each person that they are not alone in their struggle. Bringing together treatment